Welcome to the Virginia Mason Institute quarterly webinar series, Building Lean Leaders. Our presentation today is Building a Patient-Centered Culture Through Employee Engagement. My name is Diana Moses, and as an Institute team member, I am proud to introduce our presenter today, Erica Cumbee. Erica is a transformation sensei at Virginia Mason Institute. In Seattle and at client sites, she trains clients from all over the world to use lean tools and methods and helps them develop operational leadership, ensure adherence to lean principles, and embed lean management methodology into healthcare cultures. Eric and I encourage you to ask questions throughout the session using the GoToWebinar chat or question tool. We will address questions during our live question and answer session following the presentation. Today's session will be recorded and posted on our website, virginiamasoninstitute.org.
In addition, each of you will receive a link to the recording and question and answer document via email following this session. Thank you for attending. I will now hand it over to Erica to begin the webinar, Building a Patient-Centered Culture Through Employee Engagement.
Thank you, Diana. It's my pleasure to discuss a topic I am personally passionate about. Today we are going to explore the activities and behaviors of a lean leader that effectively engages staff and ultimately supports a patient-centered culture. Organizations spend a great deal of time and resource on employee engagement, but fail to achieve the patient-centered continuous improvement culture they desire. Many times these organizations unknowingly are treating employee engagement like a checklist. Met with staff 3 times around the rollout of our patient safety alert system, check. Sent 5 follow-up emails, check. Documented employee conversations, check. Effective employee engagement is not a checklist. Leaders who simply do what they say does not equal effective employee engagement. It does demonstrate the leader is reliable, but will not necessarily achieve engaged employees who support a patient-centered culture. Clients often ask, how do you know when employees are engaged? By what metric? Of course, it is important to measure patient satisfaction and employee engagement. There are multiple vendors who support the measurement of these metrics, and many times these surveys are conducted annually and do not necessarily provide leaders with as much actionable information as desired. The result of engaged employees is the reduction of waste. The result of engaged employees is the stabilization and improvement of processes. The result of engaged employees is not only the willingness to speak up when there is a patient safety concern, but to provide ideas for improvement. Here are some examples of how Virginia Mason Medical Center has not only reduced the burden of work on staff, but created a better experience for our patients. The leader's role is then to partner with employees to co-create an environment that incorporates constant improvement and adaptation in pursuit of the perfect patient experience. Employees are individuals. Therefore, engagement and the understanding of what patient-centered means may be different for each. Wordplay is one creativity exercise you can use to start to make your employees' thinking visible. It is just one way leaders can begin to engage staff in understanding what makes them tick and how do they prefer to be engaged. This similarly can be used to begin to flesh out what patient-centered truly means to your team. Start by writing the word engagement in the middle of a flip chart. Ask staff to share what words come to mind, tip of tongue, top of mind when you say the word engagement. Then begin to document these words on the flip chart. Pay special attention to words around frequency and mode of engagement. These are areas you will want to flesh out a bit more with your team. Organizations who engage in lean many times use improvement workshops, 1 to 5 day events that temporarily bring together a team of people to focus on improving a particular process. While these workshops are used extensively at Virginia Mason Medical Center and do have their place, they should not be your only means of improvement and adapting. Consider for a moment the concept of batching and one-piece flow. How many times in your organization do you hear, let's wait for the workshop to improve this process? Or, Do we have a workshop coming where we can improve this? Essentially, we are batching our improvement efforts to only occur at one time on one process occasionally. Therefore, by definition, the workshop is not the same as daily improvement. The point is that either a process is slipping back or being improved, and the best and perhaps only way to prevent slipping back is to keep trying to move forward at a continuous rate. The ultimate goal then is to hardwire improvement on a daily basis so that our patients can depend on what we deliver. At Virginia Mason, we say 50% today is better than 100% tomorrow. Therefore, we continue to create and improve daily our systems of engagement. Part of developing these systems is to understand how staff want to be engaged, so they are part of the problem-solving process. The leader is then coaching and mentoring staff on how to approach problem-solving. What are the routines and habits of daily problem-solving? I would like to take a moment now to pause and allow you to reflect on your current leadership behaviors. Please begin to list those out on a piece of paper now. Some items on this list may be checking email, attending meetings, huddling with staff, putting out fires, updating attendance records, and so on. Of this list, I now would like you to consider what percentage of your day is spent on the shop floor, the Gemba, directly engaging your frontline staff face-to-face in coaching and mentoring problem solving. Is that 1%, 5%? Some of us may be at 0, and that is okay. More room for improvement. Wherever you are at today, I would like you to begin to think of a realistic goal for increasing this percentage using this webinar as the foundation. Lean leaders have two jobs. They need to run the business and improve the business. This includes lean standard operations, identifying and facilitating the elimination of waste, using data to ensure processes are predictable and continuously improved. The traditional management approach to problem solving is giving suggestions and/or direct orders in terms of solutions, implementation, and timing. Since how you spend your time is the single clearest indicator of what's important to you, this approach is essentially saying to employees, the solution to the problem must be quickly identified and implemented. And by the way, my knowledge of the process is better than yours, so I will tell you how it should be done. Ultimately, to shift from traditional management to a lean approach, lean leaders must demonstrate 3 behaviors as a part of their daily standard work. Go see, ask why, and show respect. Go see. Go see with your own eyes. Everything you hear in the conference room, it's all lies. Standard work is not what you have written down on a piece of paper or hidden on a folder in a computer. It is what you see occurring on the shop floor. Ask why. Have a curious mindset. Seek to understand root cause. Bad systems, not bad people. And most importantly, show respect. Recognize the frontline are experts in what they do day in and day out, and begin to engage them in the problem-solving process. These 3 behaviors will move your team, your organization forward faster than any report that comes across your desk. Daily management is how our leaders manage with the Virginia Mason production system. It is a management system that consists of discipline, daily practices, and tools leaders need to run and improve their business. It allows leaders to partner with staff to improve communication, increase visibility of daily work, and improve accountability, using facts and data to ensure processes, products, and services are continuously improved and are predictable. First, visual controls. These are used to focus on the process and make it easy to compare expected versus actual performance. This is the transmission of daily management. Second, daily accountability process. This ensures that focus on process leads to action to improve it. These are the controls of daily management. checking in, auditing, status of standard work. The third, leader daily standard work, specifies the actions to be taken each day to focus on the processes in each leader's area of responsibility. This is the engine of daily management. Fourth, discipline. Leaders are role models. This is the fuel of daily management. Fifth, root cause analysis. This ensures leaders are getting to the root cause, understanding why problems are surfacing and why there are barriers to the work getting done. Leaders use data and analysis to attack problems, not using their gut or to attack people. 6, daily Kaizen. Prioritizing coaching and mentoring staff on the problem-solving process and protecting time for staff to engage in improvement. This is continuous improvement. Using daily management as the framework, there are 3 important questions a leader needs to answer as they begin to demonstrate the behaviors of go see, ask why, and show respect. The first important question is, how do you know the health of your business in real time? Do you, first, receive a report via email on a regular basis regarding the health of your business? Second, attend your team's daily huddles at a production board that outlines normal from abnormal status? Or third, are you alerted only to abnormalities once they have become so severe that employees have no choice but to alert you? I'm going to launch the poll now. Please choose one of the 3 choices. While you may do a blend, consider the 80-20 rule and what is the most frequent mode or method of knowing the health of your business. I will give a few more seconds for the last few people to continue to poll. All right, I'm going to close out the poll now and share the results. It looks like the majority of us are attending daily huddles at a production board. This is great because time and time again our employees tell us the best mode of communication, the preferred mode for engagement, is face-to-face with their direct leader. As we engage in this webinar now, think about this. Is it the exact same as if we were engaging face-to-face in the same room? The information may be the same, but overall, the experience, I bet, is not the same. It's not the same for me delivering the content. Perhaps your level of engagement is not the same. Yet many of us use email as our primary mode of communication, and we're a bit shocked when our staff tell us that they don't feel engaged. Attention is the currency of leadership. Time is the currency of leadership. When you give time, you are signaling as a leader, this work is important. You are important. I value you. I value the barriers you come against each day, and I am here to help facilitate you through the problem-solving process. The key being facilitate. As a lean leader, my role is now to frame the problem, not solve the problem. So how do we frame problems? How do we make issues so visual that we can empower our frontline staff to begin to solve them? The Daily Production Board is one tool our organization uses to facilitate this conversation. I want to acknowledge this is not one of our very first production boards that you're seeing. This board has evolved over time. Many production boards in our organization are on their 30th or 50th draft. We also didn't start out electronically. Most of our production boards are on whiteboards, and they all started out as Post-it notes on flip chart paper. This board is not about the leader. This board is about what the staff need to do their job. Therefore, they were created by and for frontline staff with the help of their leader. You can see this board clearly outlines capacity. What resources does this department have to meet demand? Daily assignments. Who is assigned to what? Demand. What is expected versus actual demand today? evidence of review by a leader, and what leader is on point. You also will notice that you can tell normal from abnormal status using a red, green, and yellow scale. When beginning to design your production board, it is important to know what is the product or service you produce. What keeps the water on and the lights running? The answer to this question will feed other various metrics on your board. And many leaders are surprised by how difficult it can be to actually answer this question. For example, when we began our daily management journey in 2012, the emergency department thought they produced healthy patients. Over time and after multiple iterations, they realized they actually produced dispositions, either a discharge home or admitting a patient to the hospital. Having this level of clarity of what you produce will begin to shift what you engage your people on in problem solving and the metrics you begin to follow that will feed your Kaizen plan, your continuous improvement plan. The second important question is, how do you know the cause of defects that are occurring? Do you first interview employees and then determine the cause? Second, do you usually know the cause based off of past experience? Or third, do you engage employees in root cause analysis to determine the cause? I'm going to launch the poll now. Please choose one of the three choices. Again, there's no judgment. Please just choose the most frequent method of understanding defect cause. I'm going to give a few more seconds. All right, I'm going to close out the poll now and share the results. It looks like there was actually a pretty even split between interviewing employees and engaging employees in root cause analysis. While interviewing employees definitely has its place, it's also important to use a systematic method to find root cause. Again, bad process, not bad people. It is a system failure. One simple example of how sterile processing at Virginia Mason begins the process of root cause is by asking staff to participate in the tracking, categorizing, and elimination of defects that occur. As defects occur at the employee's workstation, the staff member will take a pink sticker and place it in the appropriate category. That may be missing instrument, wrong instrument, debris, a functionality issue, and so on. This is real time. They also will categorize it by where they found it in the process. Is it during main assembly? Is it during sterilization? Is it during the implant phase? And then they categorize it by risk to the patient using a red, orange, or yellow scale. The leader then uses this information to begin a conversation around root cause analysis with the frontline staff. One method of determining root cause is by using the affinity diagram. This tool is a way to engage staff to look at large amounts of information and relationships. For example, if the problem was no coverage for staff out of office, we would ask staff to generate ideas by brainstorming what's creating the defect. And then we would ask them to write one cause per post-it note. Typically, this is done silently, so you engage all employees on understanding the cause of defects and their perspective. We then would have the team sort the causes into natural themes. What's similar? How are they connected? You would do this until the group reached consensus. Have the group continue to sort into these natural themes until meaningful categories start to arise. Again, there's not a right or wrong answer in creating the themes or buckets. If a team is struggling, encourage them to look through a different lens. For example, are there environmental factors, or is there a patient safety focus? This method is a great way in engaging all team members and ensuring everyone has a voice at the table, not just the most pronounced voice. The third and final important question is, how do you engage staff to drive improvement? Show respect. Do you request ideas for improvement via email? Second, do you have an idea wall or location in which you ask staff to post ideas? Or third, do you engage staff daily in process improvement using the Plan, Do, Study, Act framework? I'm going to launch the poll now. Again, please choose one of the three choices. What is the most frequent method of engagement currently in your organization? It's looking like we have a three-way tie. I'm going to give a few more seconds for the poll to close out. All right, we're going to go ahead and close the poll and share the results. While the results are fairly close, it looks like a majority of leaders are currently requesting ideas for improvement via email. While email is one method, it shouldn't be your only method. Email doesn't allow for the two-way dialogue we need to coach and mentor on the problem-solving process using the Plan, Do, Study, Act framework, the science of process improvement. What really is important is that you have at least one way to engage your staff daily to drive improvement. Effective engagement is not a checklist. Seek to understand how your employees want to be engaged. This is the ultimate form of respect. Providing your staff with a safe environment and co-creating a structure where they can speak up and begin to grow and develop in the science of process improvement, the Plan, Do, Study, Act framework. Engaging staff in the Plan, Do, Study, Act framework is just one way that we continue to engage our staff daily in the science of process improvement. Part of this is also training and mentoring our frontline staff on using what we call the idea form. This form is something that you may have placed in the department where employees can easily pull into their daily flow an idea when they have a problem or barrier occur. As you can see in the example here, the employee would outline what is the area that the defect is occurring. What is the problem they're encountering? What measures do they think should be taken? What is their idea for improvement? And what do they believe the result of this improvement would be? We also ask our frontline staff to draw pictures. What is before improvement and what is after improvement? Again, there's no judgment in using stick figures in this drawing. I now want to close with a few slides and start by allowing you to pause to reflect on what are some of the potential future leadership behaviors. What can you do to begin to engage your employees on a patient-centered culture? How can you begin to grow your employees, recognize them, and dedicate time to observation on the Gemba? By what method will you understand and facilitate the removal of defects? At the end of the day, great leaders change us for the better. They see more in us than we see in ourselves, and they help us to see it too. Great leaders inspire trust through their actions, not just their words. What actions can you begin to take today to inspire trust and promote engagement with your employees? It may be as simple as asking your employees how they want to be engaged. What inspires them? When I think back to times I felt engaged by my leader, they didn't solve all of my issues. They may or may not have been technically proficient in all of my daily work, but they did take the time to understand me as a person. They established trust, and they aided in me the capability to problem solve using the Plan, Do, Study, Act framework. They believed in me at times when I didn't always believe in myself. I'm going to close with a quote from Sarah Patterson. You have to understand that to create a learning organization, the leaders have to become teachers, coaches, and mentors, and are no longer the ones who decide what needs to be improved and how we will improve it. I think you could describe that as learning to give up control in order to get control. As lean leaders, we begin to move from problem solvers to problem framers. Look at this beautiful problem. Look at all of these issues. Look at the walking distance associated. Look at the lead time associated. Look at the rework that is caused. As a part of this webinar, we will be offering the ability to download 4 creativity exercises you can use to engage staff, including wordplay, which I described earlier. This tool will outline when and how to facilitate many exercises, such as be someone else, leaping. We are now going to be moving to our question and answer segment of this webinar. Please take the time to ask your questions now using the chat feature or the question tool. Any questions we do not get to during this time, we will follow up with an answer post the webinar.
Excellent, Erica. This is Diana again. And just as a reminder to everyone, the session is being recorded, and as well as the Q&A and posted to our website afterwards. You will have access to it later, as that question did come in earlier during your presentation. Another question that came in is, how do you overcome the zero-sum bias that overstretched systems must choose between employees and patients?
Thank you. In this question, let's define the zero-sum bias as where the patient gains at the employee's expense or loss. I think this really goes back to developing as a team. What does it mean to be patient-centered? Ultimately, our patient's experience relies on our employees' experience. And the ideas that we generate for improvement should be coming from the frontline staff. We would coach and mentor our frontline staff using the Plan, Do, Study, Act process or framework to test our ideas for improving these systems. Part of this process is having objective metrics to know whether or not the idea is failing based upon that metric. Not based upon a gut feeling, but metrics such as lead time, walking distance, and so forth. Again, these metrics should take into account what is the burden of work that is being placed on staff, so that there is a win-win and not necessarily the perception of a win-loss.
This question just came in from Jesse. Explain a few challenges with employee engagements and how those challenges were solved.
Great question. We implemented our patient safety alert system almost 14, 15 years ago now. And over time, we realized that the amount of reports we were receiving were starting to stagnate and not really reach the level of desire. What we really heard from our frontline teams was that we didn't have the culture of respect that we thought we did. And this wasn't the outright disrespect in terms of cursing or throwing things. This is really the passive disrespect around rolling your eyes or walking away when somebody is speaking. So we used what we call respect for people to begin to create the culture of having staff feeling like they were able to speak up.
Great. How do you motivate employees, and what's the best incentive?
I first want to start by saying, again, employees are individuals, and so I think it's important to ask your own employees what incentivizes them, what makes them passionate about their work. In our organization, we have systems to recognize our people on a daily basis. We have systems to grow and develop them. And we ensure that we're aligning our activities with our vision, mission, and our values. We also constantly, at least on a weekly basis, are tying back how the work of the frontline staff connects and moves the organization forward on our vision and mission.
Raphael would like to know, how do you engage doctors?
Doctors are people. I'm sure that's shocking to everyone. They have preferences and how they would like to be engaged as well. So again, I kind of go back to just ask. We're all healthcare workers. We all come in to do our best every single day, and it's really bad systems, not bad people, that get in the way in perhaps our engagement and our ability to serve the patient.
Julia would like to know, is your huddle board different from the idea wall?
Great question. Our huddle board is basically the production board I showed you earlier in the webinar. It is different than an idea wall. Typically, we would use what we call People Link, where idea generation is one component of that on a weekly basis. We also would use the production board to help alert us to abnormalities so that in the moment we can begin to problem solve using the Plan, Do, Study, Act framework.
Along those lines, the question came up, where can we find more information on the Gemba board idea?
At the end of this segment, we will actually provide you with multiple resources, and one of those is the knowledge base that you can go to for free explanations around engaging staff and daily management and what that looks like in our organization. So there you can find multiple examples of how we engage our staff as well.
Keeping on the line of the ideas, Jonathan wants to know, what's done with ideas posted to the board, and is there a process of analysis, and who's in charge of implementing them?
In our organization, we talk about standardization with the ability to individualize. So at a high level, the organization asks each department to have a process or way for the department to engage staff in daily improvement. And then that is up to the leader in that department to decide to co-design with their frontline staff what is the process based upon our business that is best for our department. One common thread, though, is that we all use the Plan, Do, Study, Act framework to facilitate and test these ideas.
Can you share some examples of how to increase employee accountability?
In our organization, using the production board, making work visual was one way that we really increased accountability. Accountability of not only other employees, but accountability of self. Again, bad process, not bad people. People are coming in to do their best work. So using the production board has been one great way where employees have not only held themselves accountable, they also can see the business at a glance and are able to level load and better support other workers throughout the day.
What unique challenges have you faced when working with other cultures, specifically with regards to changing behaviors?
Many organizations, when they start their lean journey, they are focusing on the competency of the tools, being technically proficient in the value stream map, the standard worksheet, the percent load chart, and so on. Just becoming proficient in the tools does not change a culture. I could train everyone on the webinar to be a master of the tools, and your culture would not change. It really is the activities and behaviors of a lean leader that changes the culture. Go see, ask why, and show respect.
Where the motivation level is low, how do you effectively achieve employee engagement that can drive a patient-centered culture?
I would first start by understanding what is the root cause of low engagement. I imagine some of the things I've heard from clients and my past employees is that I've raised my hand multiple times around this defect and nothing has occurred. That's something you can take action on. Or I'm never even asked my idea, so why would I even give it? That's something you can take action on.
Joe asked the question, how damaging to staff engagement is the attempt to substitute the term cost improvement with waste reduction?
The reason why we use waste reduction is because waste is any non-value adding task or activity from the perspective of the customer or the patient. If we were to focus just on cost, we may cut a value-added service to our patients. So in our organization, we find it very important to focus on the lens, the relentless elimination of waste.
How can employees drive a patient-centered culture if higher management is not on board?
Great question. Again, some of the tools I gave you today, including the wordplay, is just one simple way that managers can engage with their frontline staff around what does patient-centered mean for our team? And what are the activities and behaviors that we want to demonstrate, perhaps respect for people, as we begin to engage in improving our processes at the local level?
Richard would like to know, do you display production boards in view of the public or in a staff room?
Well, I will start by saying that space is a premium in Seattle. So many times we're just trying to find an appropriate space where we can have our team huddle around. And for the most part, these production boards are in a staff space where the board is visible to the staff and they can use it in their daily workflow.
What are some ways to increase physician hospital staff participation in engagement survey processes?
Again, our employees at Virginia Mason Medical Center have told us time and time again they want to be engaged by their frontline leaders face to face. Many times when we ask for these surveys, we're sending out an email multiple times and just asking for a response. So what are some of the barriers that your staff are encountering to actually fill out the survey? Is it time? That's something as a leader you could start to carve out and dedicate for them. Is it understanding the importance of why they need to fill out the survey? As a leader, again, that is something you can do to connect the dots and help them understand face to face why we need the survey filled out.
Todd asked the question, how have you brought people into the mindset of leading from a lean perspective and then sustaining the use of lean management methods?
As a part of our onboarding process, every employee in the organization has a 2-hour onboarding around lean methodology, the Virginia Mason production system. Part of this training familiarizes them with not only the tools and the words, but also the why behind we went on this journey. So really trying to not only get at the mind, but the heart as to why we made this culture shift. In terms of sustainability, time and time again, we tell our clients that if we could do something sooner in the journey, we would have started daily management.
Another question that's come in is, how would you use the production board and daily huddles across multiple sites or states?
Great question. Currently, we do use production boards across multiple sites, and typically one example would be an electronic board where the team would huddle via a conference line around that board. Again, that's just one example. I'm sure your frontline staff have many great examples as to how they could problem solve that issue.
Helen asked the question, if you were a new leader to a team, where do you start in understanding the dynamic and culture of the teams, and can you recommend an exercise?
All of the leaders in our organization, supervisor and above, go through what we call the Virginia Mason Production System for Leaders. So again, this is training not only around the tools, but also what are the activities and behaviors of a lean leader? What is the change management process? And how do you engage your staff in that process? The first is really by understanding your employees. Why do they come into work every day? What is their sense of urgency? What are the rocks in their shoes? Um, One board that you can see in many of our facilities is just a simple whiteboard, and on the top it says, rocks in your shoes. This whiteboard is used for staff to walk by at any time to just put in what are some of the issues that are occurring. The frontline leader then rounds on that board and does some root cause analysis with the team and begins to problem solve.
Another question that came in, how do you use patient and/or family experience to engage professionals?
Um, One method we use is called experience-based design. This method uses questionnaires, focus groups, interviews, and direct experience observations to really understand real time what is the experience of our patients. We use these observations to then feed our daily improvement as well as our workshops, and we also create metrics from these observations so as we are directing our improvement, we can understand, are we improving the experience for our patients and for our staff?
Lily asked the question, how can you engage leaders who are more focused on costs and involved in implementing lean, the education, the time, the resources?
Great question. There's many ways that you can do that. One way in which we've done it in the past is we share patient stories. We share the why behind the change. We share how patients have been impacted by barriers and how lean, how staff engagement has resolved those issues for them. We also share with them many of the process metrics I shared with you earlier today. Really around what is the time savings for staff? How can we reduce that non-value adding activity so that our nurses can spend more time with the patients at the bedside to achieve higher quality outcomes?
Another question that came in is, do you have an example of a leadership production board?
We do have an example of the production board. Again, a great place to visit is the knowledge base that has many more pictures and examples of how we engage our staff, as well as create leader daily standard work. Another course we offer is Engaging Staff in Daily Improvement, where we work with clients on creating their own production boards, as well as their leader daily standard work.
What if all employees what if not all the employees are willing to engage? How do you deal with that?
Again, I always approach employees with a curious mindset. What are the barriers that they're encountering with engaging? Why don't they want to engage? What has their past experience been with engagement? Really seeking to understand and inviting that employee in the conversation.
And I think a corollary to that is, how do you measure staff engagement?
We use multiple process metrics as well as experience-based design to understand the experience. We also currently have a vendor that we use, the advisory group, to understand what is the staff experience and press Gainey for our patient satisfaction.
Have you used lean techniques in education and training?
Yes, education and training actually ties really nicely to continuous improvement and understanding if the education we're producing, if it actually has the intended outcome. So we would actually use our target sheet similar to one of our workshops to help us understand by what metric are we moving this education in the right direction.
There's another question that came in. How can I get employees to understand what a patient-centered culture looks like?
I would first actually start by trying to understand what your employees think a patient-centered culture looks like. So again, wordplay, you could put on a flip chart patient-centered and start to begin to understand, what does your team believe are the activities and behaviors of being patient-centered? As a leader, then, you can start to reframe the conversation around, what does patient-centered mean for our organization? Do we want to create a definition as a team or team agreements in terms of what patient-centered means in our department?
Spence asked the question, I have a change in process going on. The team's overall engaged, but one of the longer-term employees who's an informal leader is now starting to talk down the process. They don't believe the process will work. Do you have suggestions that could help?
One method we would use is actually the see-feel change, creating an experience for that individual to understand the importance of change. One example I can give you from my past is that our department was considering moving to a different system. The old system, we sent pages to our staff so they knew the next task or work item to do. In the newer system, we would use a pager, but it was actually much quicker. So we pulled in the employees and we actually sent a page in front of them to the old system, and that took about 6 to 8 minutes. We then used the new system, and that took between 1 to 3 minutes. Creating an experience or a see-feel change is just one way you can start to get staff to buy in to the new change and understand the why behind it.
How do we translate the wish for respect for staff to be at the top of the executive management team agenda into reality?
There are many articles on our knowledge base around how really respect is the foundation of creating a reliable, patient-centered culture. One exercise that we actually do with many of our clients is we ask them to turn to each other and demonstrate respectful listening behaviors. We then give them a few seconds and we ask them to switch and then demonstrate disrespectful behaviors. At that point, we then look around the room and ask them to say, how many of you today or this week has demonstrated these behaviors to one another? Many times, this exercise is just one way, one see-feel change to begin the conversation as to why respect is important and the impact it may or may not have on frontline staff and their ability to speak up around patient safety concerns.
Another question that came in, for a hospital that never implemented lean before, how do you persuade people to be involved? Also, with particular emphasis on how do you get higher management persuaded to be involved?
Again, many times people need to feel with their heart the impact of the change. One way that you can do that is actually bring them to Virginia Mason Institute, where we take executive teams on tours of our frontline shop floor to experience how lean impacts a culture. They get a chance to engage with frontline staff, and then they understand on the back end, what is the structure required? What are the behavior changes needed by them to actually support this culture change? And what is the outcome of that to their patient experience and their staff experience?
Alita asks, how do you recognize employees for their contributions?
We have many ways that we do that in our organization. One way is that during the huddle, one of the agenda items is recognition. So it gives a chance for anyone in the huddle to say thank you. That's one simple way. We also have what we call the applause system, which is a web-based system where you can go in, look up an employee, and send them a quick note in a card. And this is displayed across it so we can actually visually see across the organization what are the applause or the thank yous, the recognition that people have received. Again, I think it goes back to understanding, how do your employees want to be recognized? Some of them are shy. They don't want to be recognized in public places. Others thrive off of that. So really taking the time to understand what type of recognition is important to them.
Lucy asks, how do you engage residents and medical students in quality improvement when they say they don't have time?
First and foremost, I think it's important to understand root cause analysis of why, using the 5 whys, why do they not have time, and working your way back. As a leader, I think it's also important to go out on the shop floor and see with your own eyes, what are they doing day in and day out? Is there any waste that can be reduced to allow them to give back time for improvement?
How do you measure training and education interventions you've put in place are working?
Ultimately, we want to see lean as the way we do business. It is our management methodology. So really the behaviors and the activities of go see, ask why, show respect should be observable when you go to the shop floor. As you round the different gembas or the shop floors, you should see production boards where teams are huddling. When looking at these boards, if the information is outdated, it's a cue that the information on that board is not necessarily meaningful to the frontline staff. It doesn't mean that daily management isn't working. It means that we need to move to the next iteration of the board to make it more meaningful for our frontline staff.
Unfortunately, we are out of time for any additional questions. If you asked a question and your question was not answered directly on the webinar, we will be posting a full question and answer response with the webinar to our website. Thank you, Erica. Thank you to all of our attendees for your participation today. If you're interested in continuing your learning, we have a variety of ways to support your education. You can learn about our training and services, including workshops, coaching and facilitation, and organizational transformation on our website, virginiamasoninstitute.org. You may also contact us directly via email at info@virginiamasoninstitute.org. We also encourage you to leverage our extensive knowledge base, which Erica referred to, that's on our website, which includes case studies and articles. We share this content and more on social media via Twitter, LinkedIn, and Facebook. As stated earlier, the webinar is being recorded and will be posted on our website's knowledge base, and all attendees will receive the recording and question and answer document via email following the session. Thank you again.